Okay, we're gonna get started because it's past 10:30, so we want to keep everybody on time. And so thank you for coming to the Aerolase workshop. I'm Michael Gold, and I'm going to I'll introduce all the speakers. If you all want to sit, you can see the little screen where you can sit in the first row. Whatever's easier for you. You want everybody up here. So all the speakers come on up, and that'd be great. And the concept today is that we have an international group of people that have been using the Aerolase technology, the 650 microsecond short pulse 1064 laser, which for a lot of us have changed our practices in a lot of different ways and for a lot of different indications. So our hope is that through the next hour with this really esteemed panel, we're going to be able to show you a whole bunch of things that we're doing with it. So again, the concept here with the Aerolase Neo device is that we want to keep things modern, updated. The platform that we have for this device, which is on the bottom in the middle, is really a innovation in how lasers are designed. I think that they have done a really nice job for us of making it convenient. It's a very simple device to move around. When I first started speaking for this company and doing all this stuff, it was I would say to people, this is kind of like the device that you could take on an airplane and put it in the overhead bin. So if you have multiple offices, at least, which is very popular in the US, you can transport it without having to get a big van to move it around. I mean, the convenience factor has always been important. The new devices are much more high power, which is very important. I think I've had Neo probably the longest of anybody here, and I don't think it's ever broken down, maybe once. And the way the company has it set up, that you'll get a device the next day as you send it back and so forth. But I've never had an issue in the 10 plus years that I've been working with this. And again, lots of capabilities with it. Again, with what we've set up is that, this device can do so many different things for so many different skin concerns that we're able to, sort of say it's efficacy-wise is good or better for lots of different devices that would cost a lot more money. And money is always a part of what we have to think about when we're looking at devices and how we, treat it. And I think we look at, where this device plays a role, and you'll hear all this today. Pigment concerns, really important. Pigment in dark skin, really important. Hair removal, treating veins, treating those kind of things. Acne is a huge part of my practice, and rejuvenation also a huge part of what we all do. And then you'll hear some more things about psoriasis on the medical side, how well this device can work with these kind of things. So again, what was chosen when this device was developed, it is a 1064, so it penetrates really deep. The fact that it's short pulse, though, is where it makes this big advantage in that we can get this quick pulse delivery system, which allows us to avoid pain in our treatments. And again, the energy dissipates so quick, it's so powerful, and then yet it goes away so quick. It's virtually painless. And when you're dealing, like I do every day in an acne population, pain is, if it hurts, you will not be able to use it, because most of my patients are young, teenagers, young adults, and if you start hurting them, the game is over, especially in the world of social media that we live in, because they immediately get online and they say, Dr. Gold, hurt me with this device, and that's the end of the device. And my patients actually are on social media all the time, that age group, the millennial age group, and they will write, just had my third acne treatment, incredible results, go see Dr. Gold. And it's how I get the kids to get other kids to get in, because they tell their parents about it. And again, if you keep the cost reasonable, it's pretty good for everybody. So again, safety is efficacy, safety, versatility. It is a collimated beam, efficacious, ease of use, safety, all have been delineated throughout the number of years now. We can target water, melanin, and hemoglobin. So chromophore-wise, this attacks the major chromophores that we're looking at in the skin. Goes right through the epidermis into the dermal structures where our targets are. Again, all this is important. And so, you can offer better customized care for your in-office-based treatments. So, and the last part of this, much higher return on investment, I've spoken before, this is one of those devices, I don't like talking about dollars or euros or whatever, but it's one of the most profitable systems I've ever had in my office, because again, I do a lot of acne treatments, and I do about 10 to 12 of these a day. And I charge about $200 a treatment for this, again, which is low compared to some of my colleagues. But if you do the math, it's a lot of money. And it takes about 10, 15 minutes to do an acne treatment. So again, we're looking up to differentiate our practices. We want to stay profitable, and we want to have happy patients and returns on this. So I'm going to show you just a couple slides of mine that illustrate the point of what this can do, and then we'll break down into everybody else's talks and so forth. So post-injection bruising is not very common, thank goodness, but it happens. And pulse dye laser works really well. And a few years ago, the company people and I were at a meeting, and we were sort of the only laser people demonstrating in a live injection session. And unfortunately, the doctors at that meeting bruised just about everybody that was there. And so before the patients all left, we said, just come into our little cubicle. And I actually did a protocol where whether right or wrong, I treated them, and I told them to come back in 30 minutes, and I treated them a second time. And everybody came back to me the next day that they were cleared, and showed me their faces. So really quick, really fast, it works to treat, because again, it's 1064 targeting hemoglobin, and it's painless. So there's no purpura, no nothing, and this is 2 days later in the case that we treated. One of the things that I've also really loved with this device is treatment of Poikiloderma. For the non-derms, we see this a lot. It's a combination of pigment, vascular and pigment, and some collagen loss, and you get this red-brown discoloration. And you can treat with a different red and a different brown, but if you can do that with one device, why not? So this is 2 treatments later. You can treat these venous lakes in 1 treatment usually. This is one of my patients with pseudofolliculitis and this acne keloidalis problem that we see a lot. This laser responds very nicely to that. This is 4 treatments a year and a half later. I think that's pretty impressive results. And I show this patient a lot, and I want everybody to focus on this, because this is my bread and butter, not usually this bad. So this patient, if you've never seen her, failed 4 courses of isotretinoin. I took care of her forever. And she was about to leave for India, where she's from, for a year of study. And she came to me and she said, Dr. Gold, you got to do something different. I don't want to take any more medicines. This is when the Aerolase system was pretty new. And so we treated her 5 or 6 times. I think this is actually 6 times. You have it 5 here. And then she came back a year later and she said, I went home after the 6th treatment and my skin has looked like this for the past year. So the question is, did we cure her acne? I doubt it. Was it time to go away? Maybe. But the Aerolase device took her to this point, and I don't know another device that can do this. So that's what I wanted to share with you today. So I appreciate you letting me speak. And now it's my pleasure to ask Dr. Zoya, I'm not going to pronounce it right, Evsyukova, to come up and talk about how we can use this device successfully to treat rosacea. So thank you and welcome.
Good morning, everybody. Thank you for my thank you for attention for this my clinical case. I will firstly I don't I'm a dermatologist, a cosmetologist, and maxillofacial surgeon from Russia, Moscow. And in our clinic, we have a lot of energy-based devices, a lot of lasers, but this laser is Aerolase is most commonly used in my practice because of in Russia we have a lot of patients with first and second phototype. Because of it, we have a lot of rosacea, a lot of acne patients, and now I want to show you my experience, my protocol of rosacea treatment. it's a steroid dependent rosacea. Now we will don't speak about triggers factors, about predisposing factors, but all we know that rosacea is a disease on fundament of which are dilated vessels, and these dilated vessels caused by VEGF factor, which more active than histamine in 50,000 times. And activated keratinocytes produced it. Ultraviolet is stimulate production of interleukin-1 and tumor necrosis factor, and after this keratinocytes are active and produced VEGF. So our main target is vessel. Okay, we have 4 types of rosacea, and these types can be mixed in one phase. Because of it, we can use mixed protocols with different lenses. It's a histological picture on which we see infiltration, edema, and dilated vessels, neutrophil infiltration. And this is the stage of renal phima, where we see cystic structures of sebaceous glands. So, exactly, we use a lot of medicaments. We use Accutane, we use ornidazole, we use doxycycline, we use microvasculature, anticoagulants, sulodexid. Topically, pimecrolimus, Azelix, Rosex, Salantra, ivermectin, topical Brimonide. But a lot of patients don't receive good result after all these procedures. A lot of patients in Russia use a lot of time topical steroids. 1 year, 2 year, 3 year. Our ladies use, for example, betadine, betamethasone, cortisone, and see in first time white skin, and it's okay for them, but they don't know about steroid-dependent rosacea. So my patient come to me with 15 years old, 15 years history of rosacea, and exactly she used Cinelor for a long time. And when she come to me, there was a first stage of renal phima formation. You can see a lot of papules, pustules, erythema. She had a lot of flushes. She had very hot edema in her nose, in her chin, and in her cheek areas. So I decided to treat her with Aerolase now. With my first session, I used only focal lens, coagulation lens. It was I will show you the table after my presentation. You can make a photo of all protocol. First pass was only coagulation lens in mode 3, and second pass I treat only inflammation elements with this lens, but in mode 5. And after procedure, there was a care of simple panthenol cream. Exactly. After procedure, during the first week, softening of dense infiltrates and their fusion into large cysts was observed. Exactly. However, no additional drugs were prescribed. And now you can see 2 weeks later after first treatment. On this photo, the second session, so 2 weeks later. On second session, I use coagulation lens, but in mode 3 on all surface of skin, and the second pass in mode 5. It's interesting, but after procedure, all was comfortable. There wasn't any acute rashes. And you can see here, after second, after third, after in 4 and 5 procedures, I used a collimated lens. Collimated lens and focal lens. It was a mix of two lenses. First was collimated lens, spot diameter 6 millimeters, radiation mode 6, and stage 2 focal lens in radiation mode 4. You can see here, and after 4 treatments, her skin was really tightening. Not only rosacea was treated, but her skin was tightening. And this is a treatment protocol. You can make a photo. After we can speak about conclusions and discuss it.
Thank you. Yeah, and it makes sense. Rosacea should work really well with this. If acne gets better and rosacea has an erythematous component, I mean, that's a great thing to think about with our patients for rosacea. And you gave a perfect segue. You also said the skin got tighter, and that's important in the rejuvenation world. So I'd like Bruce Katz from New York City to come up and share with us some experience on rejuvenating the skin.
Thank you, Michael. So, this is, just to reiterate a little bit, what Michael talks about, this device being one device that you can do so many treatments for. I think there are 60 different indications now, or 50 different indications just for this laser alone. So, I mean, we can treat pigment problems, vascular problems, but I like it also for skin rejuvenation. And basically, we know that the 650 microsecond short pulse duration allows us to target the water in the skin, so we get nice collagen stimulation. We can use it to treat fine lines and pores. I think, for tightening pores, this is one of the devices we use as our workhorse technologies, and for skin tightening as well. Basically, the second target can be melanin, hemoglobin, so we can treat brown as well as red pigment. And we get a nice improvement in the tone and the texture, and I'll show you a nice slide in just a moment. And that's where our patients really appreciate the fact that we can do these very quick treatments, really no downtime at all. That's a big advantage too. I mean, they may be a little red for an hour or so after, but my patients do this at lunchtime. They go right back to work. So it's really easily tolerated. For hyperpigmentation, we can treat the vascular lesions as well, and we get nice suppression of inflammation. Here you see an example for neck rejuvenation. There are not a lot of technologies we have where we can treat the neck with no downtime at all. And this is a young woman. She had been a lifeguard growing up in Florida and spent her time in the sun a lot. And her neck, as you can see in the photo on the left, made her look a lot older than her 38 years. So she wanted to have a non-invasive treatment, no downtime. So we used the 1064 laser, 650 microsecond pulse duration, 25 joules with a 6 millimeter spot. We did 2 passes per treatment, and we did 4 sessions. We usually do them every 1 or 2 weeks. In New York City, where I'm from, patients want results and they want them fast. So we have them come in every week or 2. Again, no downtime. You can see the significant improvement here in the erythema, the texture, even the fine lines improve with the device for really nice skin rejuvenation. You can see here down in the chest area as well. So this works beautifully for this type of very mild Poikiloderma. She has a little bit of brown pigment there too, and you can see the significant improvement.